Hey everyone, Rob Yang here. I've got one question for you. Where do you fall on the gluten sensitivity spectrum? So when people hear about gluten, they think, oh, maybe gut issues, they think of celiac disease, someone who's been tested and they have some severe abdominal pain, uncontrolled diarrhea 10 times a day, or severe constipation for several days at a time, maybe iron deficiency anemia. And that's more of the extreme case where, yes, it's not going to be 5 out of 10 people. However, there are other people that do react to gluten that they just don't know it. So they say it's silent celiac. So they don't have the overt GI symptoms that people have, but they manifest in a different fashion. And so one of the number one symptoms that I see when people complain to me, consulting with me, is the whole brain fog issue. So they say, hey, I wake up in a fog, have coffee, I'm still in a brain fog all day long, and I just don't know what it is. And this is not something I'm making up. I see it quite often clinically, but the research shows that it's called cerebral hypo, meaning less perfusion, so less blood flow to the brain, as well as some neurological issues that can happen. And basically they've shown that with gluten sensitivity and people that manifest in the brain, they get less blood flow. And so when you take the gluten out, they get more blood flow, and hey, the brain fog lifts. So that's the number one. Number two would be the skin issues. And I saw this firsthand in both my boys, especially my older. He's quite sensitive to gluten, and he had eczema as a child, and every time he had gluten, his eczema would flare up right away. It manifested into bumps in the back of the arms, or acne, things of that sort. And other people react that way. Sometimes they wake up and they have a red rash over their eyes. So it can manifest in a lot of different ways within the skin. Now the third sensitivity I've seen is, or the symptom is what I call pseudo-sinus issues. And those are the people that are constantly wake up in the morning as if they have a sinus infection. And a lot of people think, oh, well, that's just me, that's just normal, but it's something that they don't have to live with. And I've seen this time and time again. And when I pull off the gluten out of someone's diet, they're getting better and they're not really noticing it, but they notice it more when they put it back in. So they've been off of gluten for a month to 60 days, and all of a sudden they just want to have it, or they said, oh, screw it, I'm just going to have it. And then, boom, the next day, it's almost like they have a sinus infection. And that's a classic reaction of the immune system trying to get rid of something. Whenever you see mucus built up in your stool, or it's coming out of your nose, your mouth, snot, that's a sign the immune system is overreactive, it's trying to get rid of something. And so these are three common things that I see in my practice. Obviously fatigue can be one. There are a number of other issues that people can have when they're reacting. One of our dear friends, whenever she has gluten, her hands are achy, sore, and they have major joint issues. So just because you don't have celiac disease or a straight out GI issue doesn't mean that you are not reactive to gluten. So hopefully that this will help someone. Share it with someone. If you like the video, give it a thumbs up, subscribe, and until next time, eat well to feel well.